Well, we have seen an uptick in COVID cases in our state, but we wanted to see how severe those cases have been.
Yeah, joining us now, we're happy to have infectious disease specialist Dr. Ulysses Wu from Hartford HealthCare joining us. Doctor, good morning. How are you today?
Good morning. I'm doing great. Thanks for having me.
Glad to have you on. We always love your expertise. And I want to start by talking about how to think about sort of the reports that come out every day, especially the ones that we report on. Obviously, we used to focus on cases, because those inevitably meant if cases went up, hospitalizations and deaths went up pretty much on the same sort of curve. But that doesn't seem to be so assured now. So what are the biggest numbers that we get sort of day to day from the state that we should be looking at going forward?
Yeah, I think we should still be looking at cases. So the four things that I certainly track on a daily basis is the positivity rate. And the positivity rate depends on the denominator. And what do I mean by that? That depends how many tests are actually being done. And so we are certainly seeing an increase in tests across the state, which is going to change your denominator, which is different from early June when a lot less people were testing. But you're absolutely right. With cases will inevitably lead to hospitalizations, and then hospitalizations inevitably lead to ventilated patients, and which unfortunately could lead to deaths. And so all these things we certainly track.
All right, so more than 63% of our state is now fully vaccinated. Has that number factored into the severity of the cases, especially when it comes to this the Delta variant?
Yeah, so I think that number, I've talked about this before in the sense that herd immunity is not some sort of magic number that we cross. I would ideally like to get us above 90%, and it doesn't look like we're going to get at that point anytime soon. But every percentage above 60%, 61%, 65%, 70%, it all matters. And so how does this contribute to the decrease in severity? Well, we need to refocus on how we talk about the vaccinations. With vaccinations, what is going on is that we used to talk about it in the sense of prevention of disease, and that is always a good side benefit. Yes, it does prevent disease to a certain extent, but we really need to look at it in the sense of decreasing severe disease, taking a potentially deadly disease and shifting it to the common cold. And we are seeing that with the majority of our vaccinated patients, though I'm not going to lie that there are some people who have been vaccinated who have had more severe outcomes.
And I also, sort of on that same topic, want to talk about what you think the big takeaways for the public are from that big cluster up in Provincetown, Massachusetts, where we had an astounding number of cases at 900, considering 3/4 of them were fully vaccinated. But then on the opposite side, there were only about 7 hospitalizations and no deaths, which would be a really low rate, even for the 25% of the people just looking at them who are unvaccinated. What do you make of what happened up there?
You're absolutely, that's a great question. And so we've always had a high suspicion that possibly with this new variant that there could be transmission even in the vaccinated at this point. And so looking at those numbers, it stinks that in terms of so many people being infected, the problem, the good thing coming out of that is that yeah, hopefully they're doing better, and that means the vaccine is working. And so that is the takeaway point for this. The vaccine is doing what it's supposed to do, as I talked about before, and that's what we look for in a vaccine.
Dr. Wu, I have a quick question for you. It just came in from our viewer, Steve. He wants to know if it's safe to go to the hospital for a procedure. He's going to have a colonoscopy done. He has been vaccinated. He says he's been catching up on his doctor appointments that he put off during the height of the pandemic, but he says he's really nervous now with the numbers on the rise. What do you say to Steve?
Steve, I understand why you are nervous, absolutely. And I can tell you, and I can't speak for all health systems, but Hartford HealthCare, we certainly are doing the best to try to be able to protect all of our patients as well as all of our staff that work here. We are still screening all of our patients. We are still doing screening testing as well as screening questionnaires, and we are asking about vaccination status and so on. But the reality is during the pandemic, you're absolutely right, a lot of people have unfortunately unfortunately let their screening go, have let their doctor's visits go. And so we are missing things like malignancies, cancers, as well as just, keeping up to date on common health conditions that need to be updated and need to be improved upon. So what I would say is definitely get your colonoscopy, get whatever screening you need to have. I understand your concern, but I think it's also more important that you get the rest of the health in order as well. So please see your doctor.
All right, Dr. Wu, thank you for taking the time to join us. Let's make this a regular thing, because we had 15 questions we wanted to ask that we didn't have time to get to. So let's get to them again.
We could spend the whole hour going back and forth, really.
I got an hour. Let's do it.
All right, Dr.
Dr. Wu, thanks so much.
You.
Okay.
All right, stick with us. A lot more ahead. We'll be right back.